Today we're going to introduce concurrent treatment. This treatment approach was developed by Stephen Skelton in 2004. It consists of two phases. The first phase is called the establishment phase. In this phase, you begin by simply establishing the sound, learning the motor movements for production, and doing that in isolation. Once the sound is established in isolation, you move to a VC and CV syllable until they reach 80% accuracy. Phase 2. This diagram represents phase 2. It's called a randomized variable practice. In this phase, the clinician is going to take the targeted sound and use it in all word positions, as well as in phrases, in sentences, in syllables, and even in storytelling. But again, during this phase, practice is random. It also can be imitative or non-imitative. And finally, at the end of the session, the clinician is going to use a simple conversation to probe for generalization and understanding whether they can continue to use the sound in non-treated words.
In 2004, Skelton first created concurrent treatment for children with articulation or phonological disorders. In 2014, he worked with Hagopian to do research to determine if concurrent treatment was also beneficial for children with childhood apraxia of speech. They determined that it was beneficial. This treatment approach works for these children with childhood apraxia of speech because it focuses on the principles of motor learning. It assists children with the programming and planning of rapidly changing movements needed for intelligible speech. In 2016, Skelton worked with Richard to determine if this therapy approach works for children in small groups. They looked at children in elementary school speech therapy, and they determined that it was beneficial in improving their speech sounds. For our treatment, we chose words in producing S in all positions. Our words were soap, house, and pencil. Words did not contain clusters, did not contain the sound R, and were only one syllable aside from the medial position. In our sentences and phrases, no other words contained the target sound in order to focus on S.
What I want you to do is trace our long snake while you're saying your snake sound, okay? That was awesome! Nice job! Okay, let's get started. Go ahead and pick your first hamburger. What number did you get? 4. Okay. Our first word is see.
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 She.
Let's try that one again. This time make sure your tongue is behind your 2 front teeth and make sure you're smiling when the air comes out.
See.
There you go. Let's do it 2 more times.
See. See.
Nice job. Go ahead and feed our pig. Nice job. Okay, how about we pick a new hamburger? What number did you
4
get?
again.
4. Okay, our next word is us.
Ush.
Let's try that one again. Remember to keep your tongue behind your 2 front teeth. Turn off your voice and keep smiling as the air comes out.
Us.
Nice job. Let's do it 2 more times.
Us. Ush.
Let's try that one again. Us.
Us.
Nice job. Okay, let's feed our pig.
It popped!
Go ahead and spin the spinner. You got phrase. Okay, here's our phrase. In the house.
In the house.
Let's try that one again. In the house.
In the house.
Nice job. One more time. In the house.
In the house.
Nice job. Go ahead and use your daughter.
Look.
Awesome. Okay, spin your spinner again. You got sentence. Here is your sentence. The pencil is on the table.
The pencil is on the table.
Let's do it one more time.
The pencil is on the table.
Good job. I love that S sound. Go ahead and make 2 more dots. Nice job. Okay, let's spin our spinner again. You got syllable. Here is our syllable. S.
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 ahead and do 2 more dots. Okay, spin the spinner again. You got word. Here is our word. Soap.
Soap. Soap.
Nice work. Great job, Dudlina.
In summary, concurrent treatment uses the principles of motor learning. It's treatment for articulation, phonology, and childhood apraxia of speech. It's excellent for group therapy as well as school-based SLPs.